Swelling in the legs and the feet during pregnancy is incredibly common due to the increase in fluid retention with pregnancy, as well as the potential for more restriction in blood flow from your legs back to your heart. One of the ways to manage swelling in the legs is with compression stockings. My name is Kelly. I'm a physical therapist and a certified lymphedema therapist that specializes in lymphatic drainage. I also happen to currently be about 7 months pregnant at the time of recording this video. I am putting together a series of videos about swelling management during and after pregnancy that will be on a playlist on my channel. So be sure to subscribe and follow along to see when all of the videos are released this year. But today in this video, I'm going to share what kind of compression stockings truly work for swelling during pregnancy, share some of my favorite options, and also just show how to put them on with a very realistic demonstration. So keep watching. Now, there are hundreds of compression stockings out in the market. You can find them in a store and online, but what really works and what should you be looking for? Compression stockings are not created equal, and there are various fabric types along with levels of compression. Along with that, there are compression stockings that go to the ankle, many that go below the knee, and there are also thigh-high and full legging and pant versions too. But what is the best for pregnancy? Generally, most individuals who have mild swelling in the lower legs by the end of the day will note that a level of compression of 15 to 20 millimeters of mercury of pressure, which is that mmHg, is enough. This number should be on the box or on the tag when you are searching. This is a mild level of compression and works well to contain a bit of swelling. If someone has more moderate swelling by the end of the day, they may need to increase to 20 to 30 millimeters of mercury of pressure, or mmHg, which is a more medical grade level of compression. This level of compression, the higher, is also helpful for those who have more chronic but stable amount of swelling. Say they've had vein issues in the past or lymphatic issues, that's been mild. They may want to go to the medical grade right away. But if someone has a lymphedema or a diagnosed condition with more severe swelling, you definitely want to work with a certified lymphedema therapist in your area to get more personalized guidance. So going back to those with mild swelling during pregnancy, which is the majority of individuals, the knee-high stockings are going to be the easiest and most realistic because most of the fluid tends to sit in the lower legs and the ankles. For compression levels, that 15 to 20 for mild and 20 to 30 for a bit more moderate are great and going to be very supportive. I personally have both, and if the stocking fits appropriately, it's the right size, the difference between the two in tightness may be pretty subtle. I also like to encourage use of the ones with a silicone band at the top if someone has the thinner one. It's not necessary for everyone, but often the stockings without the band roll down throughout the day, and that can cause a tourniquet effect at the top, which can be painful, and it can actually make the swelling even worse. They will be slightly higher in price, but if you try one without a band and it bothers you, you know what you want to try next. So that's really speaking about the thinner stockings, like the true compression stockings. If someone's looking for the lower grade, I have some here. They come in more cotton fabrics, a little bit more fun colors. They're a little easier to get off and they're thicker, so they don't really need a band. If you go the thin route, they do. So there's the difference between the two. The 15 to 20, so these are by TheraFirm. I'm gonna link these down below, or the brand down below. They are, like I said, thicker, but they're more cotton, a little easier to pull on and off. They're just not gonna be as strong as far as containment or compression level for swelling than the 20 to 30. But the 20 to 30 here are a little bit more low profile. You can get 15 to 20s in low profile too, thinner. So if someone's in a warmer environment, you probably don't want the thick, heavy stockings like someone in a colder environment will want. So these will come in 15 to 20, they'll come in 20 to 30. They actually come in a little bit higher too, but because they're thinner, I would look for the silicone band just to avoid some issues. So I will place links for my favorite ones below, including the exact ones that I use as a professional and someone who's pregnant. There are many brands out there that likely work, but as a lymphedema therapist, I choose the brands that specialize in compression stockings because the quality is higher and they create stockings with a gradient pressure, meaning they're snugger at the bottom and less at the top to encourage fluid pushing up and out of that area. If someone has more fluid in the thighs and the lower body, then looking for a thigh-high stocking or legging is also a great option. To be honest though, working with compression stockings for the last decade, thigh-high stockings often need to be adjusted and pulled up throughout the day because they don't stay in place as well because of the shape of our thighs. And so they get a little bit more annoying to deal with for a lot of people. So I personally would go with a legging, like a full pants legging. There are brands that specialize in compression that also have a line of leggings for pregnancy, like this one. This one's from 𝐋𝐸𝐲𝐬𝐧𝐠. Gonna link this down below. They are snugger than just purchasing a pair of general leggings at Target or a maternity store, but that's because they are meant for swelling. So this is 15 to 20 level of compression throughout the whole way. So keep that in mind. There will be a little bit of extra effort needed as if you're not used to getting already dressed with difficulty while pregnant. So now that we have spoken about what kind and type of stockings work well for swelling, let's show how to get these things on while pregnant. Now I'm currently just shy of 7 months pregnant with my first, and there's only one in here, so I completely understand if someone further along in their pregnancy or having multiples or simply just showing in a different way, this may be slightly more challenging. Okay, so I'm going to show how to get the compression stockings on and off. If we'll start with the 20 to 30s, the thinner ones, one thing you do not want to do is you don't want to try to pull this on just straight, pull from the top and pull up. What's going to happen is that it's going to just get stuck at some point and it gets really challenging from there to try to pull it up. So you don't want to do that. The other thing you don't want to do is to try to scrunch it up and then pull on, because the fabric gets really tight when you have multiple layers. It's just not going to go very well. So what I do and teach to my patients is to reach in, pinch and grab at the heel and hold that, flip the other part inside out, and then you only have really 2 layers, so it's still a little bit loose and easier to pull. For positioning, you could either put your foot up on a step stool. If the bump gets in the way, you might have to put your knee out to the side. I'm getting to the point that it's just easier for me to cross over. If someone's able to do that, that's gonna be a challenging, but then you don't have to bend over as far. So from there, I have it flipped inside out. I'm just gonna put the heel on and the foot part first. So I'm just pulling that part on, then come back with that second half and pull that on in one big pull. And then you're gonna have to come back and make sure that you don't have any creases. So I assembled the top, but I'm gonna check the toes first, pull those out. The heel piece, you should be able to see that is in the place of the heel. And then I have too much fabric here, so you can either just start to pull down a little bit, too much fabric at the top, or if you have a rubber glove, like a dishwashing glove, you can just kind of pull down with the glove on, and that works really well and a lot easier. But just make sure that you get all this extra seams out, because you don't want that irritating the skin. And then from there, make sure your toes are comfortable, make sure it's not digging in behind the knee, and then the stocking is on. So I'm not going to complete the whole thing again, but flip or reach in, grab the heel, flip that inside out, pull 1, and then pull 2. That is how I get that one on. So then to pull it off, what you also don't want to do is just take it and push down. You're going to get it bunched up at the ankle and you're going to struggle to get it over the heel. And we can't bend over very well for a long time and get out of breath. I already am out of breath. And so we don't want to do that. What you want to do is just flip it inside out or flip it backwards and then just start pulling straight. You can kind of take it in sections like that. I'm going to pull it off in a second, but you could also, if you really can't bend over, put this on the ground like this, step on it with the other foot, and then you can kind of pull that heel back and that will rip it off the foot gently, and that will make it easier to get off without having to bend over. Shout out to one of my patients for teaching me that one. But if you can, it's just pulling straight, and that's going to be the easiest way to take it off. Now that's for some of the harder stockings to put on. For some of the really light cotton stockings, you may be able to pull them straight on. If you're still struggling, I would still do the inside out technique, but some of these thicker cotton stockings do a better job because they're not as stretchy. Like these stretch a lot. These do not stretch as much. So you will have a little bit more grip if you want to try to pull it on straight and then pull it up. And then again, make sure that you're looking for seams and fit, and then to take it off, flip it inside out and pull. So that's how I get stockings on and off. You can see I'm a little out of breath because I'm talking when I'm doing it, but the less you have to bend over, the easier it is. So trying to bring your leg up to you and then using the technique so that you're not working extra hard to pull these things on and off with extra time. So that's how I get compression stockings on and off. Again, I'll put links down below for all of these stockings that you can go ahead and check out. I do have discount codes for some of them. Again, I'll put that down below. So if you are watching and just thinking I'm crazy and that there is no way that this is going to work, then you can check out a donning aid. I will link a couple of my favorites down below, but there are a few out there that you can put the compression stocking on while you're sitting, and then you put that donning aid on the floor, and with handles or ropes you can actually pull that stocking on. So it's just going to be a lot easier and that you don't have to bend over as far. I also have another video on donning aids which I might be able to link as well, but they exist. I'll put some links down below, so a lot of options for everyone. But trust me, I understand no matter what route you go, it's more effort than you'd like it to be. At least that's how I feel sometimes. So I hope this information was helpful. It's a topic I get asked about a lot. So for more information though, and content related to just general swelling and edema management, you can check out the rest of my channel. For more specific content related to pregnancy, you can check out my playlist on swelling and pregnancy. And other than that, I will see you all in the next video. Thanks everyone.